My presentation is entitled Final Results of a 5-Year Cohort Observational Study to Evaluate Respiratory Symptoms and Abnormal Lung Functions among participants who use IQOS with heatsticks compared to smokers of conventional cigarettes. I'd like to acknowledge contribution of my colleagues from the Academy of Preventive Medicine of Kazakhstan, Doctors Arnautov, Yermakova, Bigzhanova, Tulybekova, and Yerleev. The aim of this paper was to analyze the functional outcomes of COPD assessment test, CAT score, post-bronchodilator spirometry results, 6 minutes walk test, and components of metabolic syndrome over 5-year follow-up time in long-term smokers who cannot quit smoking. Another aim was to compare these function outcomes between smokers of combustible cigarettes, CC smokers, and those who shifted to heated tobacco products, HTP use. The demographic and clinical characteristics of the participants by baseline smoking status are presented in Table 1. 1,200 recruited participants were followed up for 60 months, during which 31% of participants were lost to follow-up. Smoking behavior by visits presented in Figure 1. There were no significant differences between CC and HTP users at baseline, except for CAT score, which was significantly lower for HTP group. The dynamic of the main outcomes between baseline 12, 24, 36, 48, and 60 months follow-up are presented in these figures. Are estimated marginal means of CAT score, FEV, FVC, 6-minute walk test, waist size, triglycerides, glucose, HDL cholesterol, systolic and diastolic blood pressure. Overall, both CC and HTP users experienced improvements in all health outcomes, except for measures post-bronchodilator lung function parameters. Both CC and HTP users experienced decline in lung function, but HTP users had better scores after 24 months of follow-up. The analysis presented in Table 2 show that all variables significantly changed over time. In particular, CAT scores significantly decreased for both CC and HTP users from 13 to 10. The 6-minute walk test increased from 517 to 540 meters for CC users and from 514 to 538 for HTP users. As seen in Table 3, for the models with time was used as continuous variables, statistical significant difference between dynamic in HTP and CC groups was found for CAT score and FVC. The coefficients of repeated measures analysis of main outcomes with smoking status, HTP versus CC, as main predictor are presented in Table 4. Smoking type was significantly associated CAT scores and HDL cholesterol levels. The CAT scores have improved over time for both CC and HTP users, though HTP smoking was significantly associated with lower CAT scores for 60 months follow-up compared to CC smokers. This was statistically significant observation. Having larger number of PAC years, female sex, and having previous history of lung disease increased the CAT score. Post-bronchodilator FEV1 and FVC have decreased over time for both CC and HTP users. FVC dynamic for HTP users was significantly better compared to CC users. This was also statistically significant observation. Factors negatively affecting FVC were age, history of lung disease, and being female. Among the components of metabolic syndrome, waist circumference and triglyceride triglycerides decreased over time in the observed participants, while fasting blood glucose and diastolic blood pressure increased. In conclusion, a comparison of smoking behaviors between conventional cigarettes and heated tobacco products users revealed that the marginal mean estimate for CAT score was 0.465 points lower for HCP users than for CC users. Additionally, VC pre-bronchodilators results indicates a 0.026 higher value for HCP users. This finding suggests that transitioning to HCP use may have less adverse effect than continuous use of combustible cigarettes for individuals with a long smoking history. Future research should focus on extended follow-up of these cohorts to explore the impact of shifting to HCP on both existing and emerging chronic conditions, as well as various health-related measures and outcomes. Further analysis, including chest computed tomography data, exacerbation frequency, biomarkers, and other relevant indicators, is crucial to comprehensively assess the differences between smokers of combustible cigarettes and HTP users. To achieve a more thorough understanding, in-depth assessment using methodologies such as Markov chain, propensity scores, and time lag models are warranted. Additionally, there is consideration for transition toward the Clinical Data Interchange Standards Consortium, CDISC, Operational Data Model, ODM. This strategic shift aims to enhance data management capabilities, improve research outcomes, and uphold top-tier patient care standards. Notably, the FDA has played a significant role in advocating for the adoption of data standards like ODM in clinical research. Thank you very much.